Well, a late good afternoon to all the survivors. I'm extremely impressed that you've managed to last this long. It's been a bit of a marathon day. In fact, it's been a bit of a marathon week. But we've made it this far. And it's really a pity that we don't have a bigger audience, simply because I think the audience certainly doesn't do justice to the importance of this conversation and to the importance of this session. Being that as it may, I'm delighted to invite the speakers to the stage. I'll go with no particular order, but we can start off with Charles Watkins. He's a clinical psychologist, as well as a licensed psychotherapist, who is the founder of the Mental Health Support Solutions. His devotion towards identifying places of need for dealing with stress and depression has led him to the maritime industry. Through the team's profound research in the maritime industry, Charles has been able to create training videos and safety plans for crew and onshore personnel. Charles, please. Next, we have Yanis. Yanis Vafilothis is the CEO of Care4C, a startup specializing in creating a better workplace for the crew. An ex-cadet and fully trained mental health first aider through Care4C, he provides a holistic approach to mental health, adults, policies, and via high-tech wearables, gathers data to enhance practices for the well-being of seafarers. Yanis, please. Dr. Deepti Mankand is a professional development trainer, wellness coach, and counselor, as well as the founder of MindSpeak. Deepti has participated in many safety at sea conferences and seminars right here in the UAE, and unfortunately could not join us physically. Fortunately, though, with today's technologies, we hope we have her a full virtual participation. Hi, Deepti. Mariangela Zanaki is an organization development consultant, a psychologist who works as a maritime HR consultant at Siosan Consulting. She has a deep understanding and extensive experience with psychometric assessment methods and collaborates with some of the world's best-known assessment companies to provide maritime organizations with useful insights for seafarers and the shore-based selection and development of processes. She's also an experienced trainer and holds a long-standing collaboration with DNB Maritime Academy. Mariangela, please, welcome to the stage. And last but not least, Ben Bailey is the Director of Programs for the Mission to Seafarers, the Anglican charity for mariners and their families. He now heads the missions program department, working with the Mission to Seafarers regions, the shipping industry, governments, and civil society to create effective crew welfare and well-being services globally. Thank you, everyone, for joining. I'm going to take my seat, and we're going to tackle this very important issue of mental health for seafarers. Test. So, situated in the open seas and working with hazardous equipment and chemicals, offshore workers and mariners face more taxing demands than the average employee. However, these threats can be hard to detect and address. The psychological stress of offshore work is widely known, yet seldom acknowledged. How do employee health and well-being fit into the ESG wheelhouse? That's overall topic for discussion. And to kick off the actual subject, let me start with Charles. Determining mental health gaps that need to be filled for creating a successful framework. How do we determine those needs and gaps?
So that's a very good question. First of all, let's just all get on the same page. Gaps are there. They're clearly there. We deal with it on a daily basis. We get calls from seafarers. There are constantly serious mental health issues that happen on board, and these things need to be addressed, right? I'm actually very happy and proud that we've been working with Sea Horizon in Qatar for the past couple months on not just identifying these gaps, but also looking at possible and proper and practical solutions to these problems. I always say, when nothing changes, nothing changes. It's time for change. We definitely need it. And if we continue this way, these problems are going to continue to exist. These things aren't talked about openly, but we see serious problems, psychological difficulties, mental health disorders. We see murders, we see suicide we see psychotic breaks. We need to have proper training and proper education in place to recognize these things. People that can spot them early, these red flags, these symptoms. The earlier we do this, the better, because we can create a holistic approach that is a proper clinical solution to these problems. We've been doing this for 5 years. We deal with these cases every day. It starts by recognizing that we actually have a problem, by talking about it openly. By allowing to talk about this openly, we create a normalization for this. This is normal. Everyone struggles from this. Everyone can struggle from this in varying degrees. So it's all about offering those solutions in a practical way. Practical for the seafarers, the industry, and looking at ways to do this in a competent, clinical way, data-driven. And there's one thing I want to mention about experts. So, yes, I am an expert, and I deal with these cases daily, and I've trained a long time for this. But I want to say that the most important thing is determining what the problems actually are. And the only way we're going to do this is by asking the people on the rigs, on the vessels, what are the problems? What are your challenges? What are you seeing? What do you need? These people should be giving us the information so we can act. Every vessel is different, slightly different. There are individual challenges as well to every vessel. That's why we always do an assessment, an evaluation of what needs to be done right here. So I think it's important to remember that before we start this process, we need to find out what are the actual problems, because those people are the experts.
So, excuse me, then how, if I may, just from a clarification standpoint, we have so many vessel owners here, and I will focus the discussion more on the offshore side because that's really what today's forum is about. But the answers and the problems are not isolated to the offshore. They're very, very common to the maritime industry.
Very much so.
The question is there an outreach mechanism to reach owners so that they can have the crewing department and the technical department and the HR department actually get you on board to meet the seafarers, to ask them what the problem is? I mean, how do you get to the root of the problem?
Yeah, that's a very good question. So, in my experience, we actually get activated by the crewing department or by the insurance. They're the ones who say, usually we go to vessels or to rigs, to offshore rigs, when bad things happen. So lethal accidents, for example. That was the last year I was on an oil rig offshore, and it was the crewing company and the insurance that actually asked us, they activated us and say, we need someone there. There needs to be a proper process in place to do this, though. It's still very individualized. In this case, the crew was traumatized by the type of accident, by seeing someone they were very close to die in front of their eyes. The crew needed to be evaluated for fitness, for post-traumatic stress. So I completely agree. There should be a way to do this, to determine this, but in the past, it's been over insurance companies and crew superintendents.
Let me get some perspectives. Mariangela, you're part of an OD process and system. Do you get involved with the front end of getting this kind of feedback from crew, or how do you suggest that we determine the question?
Yeah, but there's also another way of looking at it, a sort of more strategic way of looking at it. So trying to really understand how companies can not only, promote, but also prevent any problems that might, harm the psychological well-being of people. And it doesn't really matter if it's at shore or in the vessels. It's more really about, how each company decides to actually take a strategic viewpoint on the, psychological health of their people. Because when psychological health is missing, what we're doing is we're sort of building walls instead of building bridges. So it's important to understand, what the impact of psychological illness is. And like Charles said, first of all, you need to normalize it. It's very prevalent. Mental health problems, like 1 in 4 people or 1 in 2 people, will be affected. So it's really about, talking about the emotions and getting people to normalize that, any day you may be facing difficulties or not feeling well. And that may have to do with your, work, and all the workload you have. It may have to do with the relationships, either on board the ship or at shore with your colleagues or at home. So, taking a strategic viewpoint means taking a step back and really designing how you can help your workforce, feel well, essentially.
Dr. Deepti, I'll come to you. Can you hear me all right?
Yes, I can hear you.
Perfect. Good to see you again. The last time I saw you, I think, was the Safety at Sea conference at TriStar.
Absolutely, yes.
So what is your experience in terms of determining, what the mental health gaps are and how to actually, where do you get that feedback from? We've heard from a strategic standpoint and we've heard from a hands-on, on the rig, post-trauma. What's your experience?
So now I have an opportunity to work at grassroots level. So I work with all the seafarers, and of course, I have to do a lot of sessions and counseling sessions with them. But apart from them, also we do a lot of training on mental health. Now, currently, if we all, I'm sure everyone here is aware of it, that the United Nations Good Health and Wellbeing Sustainable Development Goals, they have called out for 80% of the nations to integrate mental health into primary healthcare by 2030. Now, 2030 is not far. If you go to see, it's maybe 6.5 years from now. But when they did announce that, WHO, they published a data in 2021 where they showed only 25% of nations have a system in place to do that. So that is the harsh reality. We do talk about mental health, but we don't have systems in place to take care of it. So coming to your question now, how do we determine it? Well, every company today, because now it has marine industry is a very reactive industry, I always say that. So when some things go wrong, that's when everybody stands up and they want to do something about it. But like what Charles said, very true, that when the people are working out at sea, they have problems and we need to hear to their problems. And it starts with conversation, it starts with breaking the stigma, and mainly it starts with breaking the mindsets of people. And in the marine industry, the data which we get is directly from the company, because I work with a lot of companies. So we've had a lot of problems which the seafarers are facing. Yes, some of them have a lot of anxiety issues, some have depression. We have young cadets who jump overboard because they're not able to manage on board. There are emotional disturbances which they go through. So the causes are plenty, and the data is first hand data which comes directly from the company to me, because then that's how we have sessions with them. So the situation is quite different than how we generally, when you look it from outside, you don't come to know, but when you're working in the system, that's when you come to know that it is a very grave situation, and it's high time that collaboratively all companies start working towards it. So yeah, so all the data which we get is firsthand, because I am working with cadets as well as we are working with all the other companies as well.
And is that through the crewing department typically or the HR department that comes to you?
Yes, so in different companies, they have different kind of departments. But in India, we have a couple of companies who have designated departments. Say, for example, fleet management has a fleet care department. So their entire workforce in that department works for the well-being and psychological health of their seafarers. And they have also on board a clinical psychologist in their team. Then they also have helpline numbers, dedicated line numbers, which are specifically for the seafarers, which is free of cost to the seafarers. So they can pick up and make a call and talk, and confidentiality is maintained. So you'll be surprised to know, if you asked me 5 years back, seafarers never opened up about their mental health problems. But today, they do pick up the phone, they do talk about it, and they do want to get help now. So definitely there's a kind of a shift happening, but still a long way to go.
Thank you, thank you. Ben, from the mission to seafarer standpoint, how has the mission interfaced with these issues, and what are some of your experiences when you have to determine what the gap is?
Yeah,
in terms of
absolutely.
mental health?
Well, I mean, many of you will know that the Mission to Seafarers operates in 200 ports across the world. And so we have across 50 countries, and last year we made over 30,000 ship visits, ship welfare visits. And I think what's really interesting is what several panelists have already referred to, which is the culture of the company that the seafarers are working with. We notice when we're ship visiting a massive difference between those seafarers where they feel that they are on board a ship where they can open up and they can say things. Conversely, on the Seafarers Happiness Index, which we run, we will see seafarers who are concerned about if they open up, because so they score low, they say how unhappy they are. So I think, when you're identifying the gaps, companies actually have to look at themselves first and foremost and say, what kind of culture as an organization are we trying to create? And I think the other thing that, from our perspective, is often missing is that we all know the international makeup of the seafaring population, and everyone is coming to mental health from a different perspective. It's that cultural perspective. Attitudes to mental health in the UK and Europe are vastly different from that of Eastern Europe or the Philippines or other countries. And I often think that, for us, when we're talking to seafarers, we have to recognize that everyone is starting from a different point, and overcoming that stigma, which is so important to enable a community to actually thrive and discuss their issues.
Absolutely. Yanis, I'm intrigued. From your standpoint, you've been a cadet, you've been through the system.
Yeah.
How do you feel about determining where the gaps are?
Well, yeah, I wear various hats, so I kind of look at it from different points of view. And we have the buzzword or the buzz acronym of ESG at the moment, and crew welfare and mental health is in that. I promise you it's in there. But it just doesn't seem to be getting the voice that it needs to get, and I'm happy that panels like this occur so we can promote crew welfare. But we need to understand that, Mariangela mentioned this as well, and we all know this, that it starts at shore and then it sort of permeates its way down to the seafarer. So if the shore side haven't bought into it, then the seafarers won't get access to a lot of these incredible facilities that they all provide and support. So, my first step as any operator or owner would be, let's start creating a plan and also allocate a budget for crew welfare. And that's more than just a ping pong table. These magical ping pong tables don't solve everything. We need a bit more than just that. And to understand that it's not going to happen overnight. The plan will take time, 2, 3, 4 years before you start seeing any results. So don't lose faith if you do sort of a one-off arbitrary action towards crew mental health and then go, oh, well, we did something and it didn't really work, so we're not going to try it again. It's a long process, and I know my panelists have been doing this for a lot longer than I have, and I've been on the receiving end of some situations, and I realize that it's not going to sort itself out tomorrow. So I'd advocate for getting a budget in place and getting a plan in place that goes beyond just tomorrow and the day after. It's got to reach out into a 2-3 year plan.
It's sad, but I think one of the fundamental issues has to be everyone knows what the seafarers feel. We have a sense of what they feel. This got so amplified during the pandemic, 14 days of quarantine before going on board, then 14 days coming off. And of course, companies paid the price as well. They've got crew for 14 days when you need them for 7. So there's all kinds of issues involved. But honestly, I suspect that management is actually oblivious of the actual mental state of mind of the seafarers, and worse, many of them are indifferent. And they think by having an office party, we've solved the problem. We'll do a Christmas party, we'll do this, we'll do that, we'll distribute. That's really not the point. How do you get to the nub of the issue? And one of the questions that was raised was data assessments. What are the systems or processes in place that allow us to receive, analyze data, come back to management to first get their heads right before you can get the seafarers' heads right? So what's the view on data assessment? And let me start with Mariangela.
Yeah, Well, you can include management in your data assessments as well, because when the doors close, either you're a seafarer and you go and in your own cabin, or you're the CEO and you go to your
Office.
own bedroom. If you're dealing with a mental health issue, it doesn't matter if you're, a seafarer or the CEO, and you probably will. And it's actually, we know from statistics that people in high status positions tend to suffer a lot from stress. So the C-suite has a lot of stress, essentially. So you need to gather data on what stresses people across levels. That's definitely one of the things that you can start with. I mean, as Yanni said, it's a long process, and you need to plan ahead for it, and you need to look at it like both a marathon and a sprint. So you want to know where you're ending, but you also need to know where you want to prioritize. So you start by gathering, your data and what stresses people, like Charles said. Your seafarers or your people ashore. And then you can also gather data about what makes them feel well and have, because, health is defined as not just it's a complete state of physical and social and mental well-being, and not just the absence of disease or disability. That's the definition of health, and it's been, unchanged since 1948 by the World Health Organization. So data is not just, gathering information about the absence of disease or disease, if you have it, because that's not what health is. It's a step, more than not having a disease.
So question is again, how do you gather the data?
You can
How do
use many
assessments?
sources of information, and you should use multiple sources of information. I mean, you can use information from the work that Charles does, or from the Mission to Seafarers. You offer a lot of data on the happiness index. You can do psychosocial risk assessments, which are things that, I mean, we do those sort of things, which look at, what stresses people. You can look at the indicators, the health indicators you have from, physical or mental well-being. You can use psychometric evaluations.
So if I were to ask, let's say there are 10 companies in front of me, and I want to do an audit
Yeah.
to check the mental health, the status of well-being, if you will,
Yeah.
of all the seafarers in all the 10 companies.
Yeah.
How would I go about it? Let me start. Charles, and I'm not an insurance company.
How do you gather data from 10 different captains from 10 different companies? Is that the question? Mm.
I mean, how do you rank? How do you assess it? This is a happy workforce, this is an unhappy this is an unsafe workforce, because safety is so important to mental health.
So let me start by saying you're absolutely right. You need to reach the management. The question is, what does management respond to? Safety. You need to connect psychological well-being, the importance of mental health, with safety. And I mean safety in accidents, safety of the vessel, yeah? But I also mean when things go wrong, diverging it, when things go really long, emergencies, disembarkation, all that stuff costs a lot of money. They want to know the vessel's safe. They want to know, how can I save money? That's it. I'm sorry to say it, but that's it. Let's be honest. So that's how you reach these people. And how do you do this? You need data. We do different types of assessments. First of all, we do pre-boarding assessments. So we look at, is this person fit for sea? Is he ready to go on the vessel? Is it likely that he will have a mental episode, or is he resilient? Number two is, we get the clinical data from all the calls. And after 5 years, and I'm sorry to bring this up, but insurance companies have this data, and they're calling us back and saying, now we can see that these cases that have been very expensive in the past have now been properly assessed, they've been properly treated, so the seafarer could carry on, there was no emergency. They're seeing the costs that are being saved. And you can only do that by having clinical data that we're treating people, we're having consultation sessions, we're helping with disembarkation, we're recognizing suicide ideation, we're recognizing depression, anxiety before it gets too bad. Okay, so that's my answer. Yeah.
Interesting. Yanis.
Yeah, well, what we're trying to do at Careful C is to be able to find an objective data point. So we're trying to find ways of using wearables to look at things like sleep quality and heart rate variance to be able to sort of help with everyone else's understanding from the subjective side. You know, yes, I can see that they're answering the questions like this, but I can see that the physical data is saying something different, or there is a connection between what they're saying.
Variables in terms of heart rate?
Yeah, and even just the watch like I'm wearing here. So that's what we're looking to do, and this means that you get a continuous data set, and you get to catch the ebbs and the flows, because sometimes you may see someone on a good day and oh, life's great and all that, and then the next day you may catch someone else and they're like, oh well, actually something's going on at home and I'm not so.
What kind of wearable would indicate that?
So I'm talking more about looking at the heart rate variance and the sleep quality. So if you see sleep quality is reduced and the weather conditions on the vessel are fine, you go, okay, well, there's something going on here. There's something I can dig into, and this is where you have the data and you need people to analyze the data, and that's where the medical professionals on this panel can go, okay, well, I'm looking at this data. How can I analyze it? What can I look at? I can see something's not going right here. I need to get on a call and just see what's going on before it bubbles over. And again, what has been mentioned, there needs to be a feedback system. So the pre-embarkation interviews and the post-embarkation interviews are really important. It's something that all companies, and see the massive companies have thousands of crew, it's very difficult. But personally for the fleet that I operate, we know a lot of the crew personally. So when they come back, Captain, tell us, what was your, what could we have done better? What was different? Oh, you guys went to Russia and the temperatures were sub-zero. What could we have done better to facilitate those situations? They want to know that they're being heard. They want to know that action will be taken as well.
Dr. Deepti, what is your experience in terms of getting the data, getting source data? How do you collate or collect other than having a crew manager call you?
So, like I said, again, definitely it starts with the management, but not all companies do it. I'm sure we all know how companies work. And so definitely all of the companies do not do it. So I was just hearing to all of you were saying how the data is, collected, and we discussed about certain psychometric tests which are done. So when the person is joining on the vessel, everybody has to go through a psychometric test. Now, what does that test actually give you? So you'll be surprised to know that people have, when you're giving a psychometric test, first of all, they call you to the office, you're sitting in an AC room and you're attempting that test. So when they're doing it in an environment which is absolutely stress-free, it's very difficult to actually find out that are they actually stressed at that point of time or not. So if you ask me, I honestly feel when they're on board the vessel, that is when you need to have a system when you can collect data. Because when they're back from the ship and when they're back home, they are not in the same mindset. No seafarer is, So how they are on ship and how they are outside, they're two different things. There's a lot of difference. So firstly, when we talk about collecting data, we have to first understand we are collecting data when they're back from the vessel, but we also need to understand that when they are on the vessel, what about their health and psychological health at that point of time? So there is no set system in place where we can get continuous data from the vessels as of now. Yes, getting it from few seafarers is a different thing, but getting it from a pool of seafarers is a very different thing. People have cleared a psychometric test here in the company. They've gone on ship, and that third officer has stabbed the master 20 times. So when the company called me and when we discussed the case, he said, but he was clear in his psychometric test. We didn't see any deviation. And that same person landed up doing that on the vessel. So we really need to question, because the environment on ship, I belong to a seafarer's family. I have sailed with my father. I have seen that time and this time now. So the environment on the ship today is very, very different. It is not something which we can compare it to an office job here or a person who's sitting and working in the office. So when you talk about getting data, the data which we are getting, it is not an accurate data. So
So,
if you want, yeah,
yeah, please,
sorry.
no, please finish. No, go ahead.
Yeah. So if the data accuracy is not there, what are we aiming for? And this has always been a question to all companies, to all the panels which I've been to, that the data which we are getting, is it valid data? So that is because working on board the vessel is very different than we sitting in office and trying to collate that data.
So let me ask this question. Is there any empirical data that we have as an industry that says embarking on the vessel, what is the average level of happiness, for example? And when he's disembarking from the vessel after a voyage, what is the average level of happiness? Because when he's going on, he's broke, he needs the money, he needs his rotation, so he's going on. So he's excited, he's going to earn some money. When he's getting off the vessel, hopefully, he's happy because he's earned his pay package and he's going to go home. But if we have a problem at home, he doesn't want to face, we have a problem going on board, he's got a captain he doesn't like, there are other factors. So is there any assessment of these guys are happier going on or getting off?
No, as of now, I don't know about it, and I don't think that is there because, like I said, any other additional work or checklist or anything which we come up with and we give it to the company, the first thing is we have enough paperwork to do already, and now this is going to get added on. So, like I said, it cannot be a checklist, it cannot be a tick box activity. It has to be something a part of the system, like any other checkups you have, or any other, like, when you do risk assessment, people have so much of things and documents in place. But when it comes to psychological assessments, I think we're still a little behind in that.
About the
I'm
panel.
sure
Let me
others
ask
would
the
have
rest
to
of the
add on to
panel.
this,
Any
I'm
such
sure. Yes,
empirical
absolutely.
evidence or any data to support this overall concept? Are they happier going on or getting off?
We obviously run the Seafarers Happiness Index, but we don't assess seafarers at sort of different parts of their journey, not on a global scale level. We do run a series of bespoke indexes for companies where they can actually assess their own crew, and then they can do some benchmarking against the global thing. But I think what's really important, it's not a psychological assessment in any way, but we ask seafarers how satisfied they are about levels of shore leave or training or food on board, etc. But I think what Charles said is really important, is that if you are an organization which is having a bespoke index or doing your own sort of listening to your crew, how prepared are you to actually act on it? Because if you don't act on it, then those seafarers will feel even more demoralized than perhaps they already were. And certainly, I have lost count the number of ship managers, CEOs of companies who have commissioned indexes and said, I wish I had asked these questions earlier, because had I known, we could have done something about it. But I think also, to your point a few minutes ago about trying to make people on shore understand the importance of all of this, certainly increasingly when I go into shipping companies, I am meeting people who have are in senior management positions, but who have actually never been a seafarer. They're no longer masters that have come ashore and taken up senior positions. So from our perspective, we actually have to educate those people as to why their workforce then needs to be looked after and supported in a particular way. So it is it's that word that we always talk about. It's using an holistic approach to the welfare and well-being of the world's crews.
Would anyone else like to comment on the subject? Let me ask the audience, all 6 of you. Any question for the panel at this point? Anything that you'd like to know from a mental health standpoint, mental wellness standpoint? How are we dealing as an industry with our seafarers? Are we doing them justice? Is there any question or concern that you'd like to ask? Okay, then we'll continue. We talk about this. The questions are a closer look at benefits and opportunities to build a resilient workforce. I guess, in more simplistic terms, what do we need to do as companies to make our seafarers feel better or be better? Let's start with you, Yanis.
Well, this is some stuff that I've done personally myself as well. Training around mental health needs to be really important.
To the people or to the Bosses.
To both really. You start at the bosses and then you bring it down to the crew level. There's a lot of myth busting. Mariangela came to my company and we did this training together, and I believe we did a lot of myth busting that day. People sort of going, oh well, if someone's struggling then they can't work. Well, actually no, they can work. It's not just sort of black and white, and it's making people understand that here's a scenario and things are okay. You don't need to just sort of say, oh well, that's it, disembark him. So there's a lot of breaking down those stigmas that are currently out there, because a lot of people still don't quite understand that they're there. The one thing that I would do, and I recommend for all operators, is have at least on board every ship one mental health first aid officer. It's a 2-3 day course. It doesn't take long, but it means that you've got at least someone on each ship that has an antenna that's listening. They're not going to solve the problems, but they're going to, the three sort of basic things. They're going to say, well, okay, I'm hearing that someone may have an issue. Have you thought about some support? Speak to your family, and if the problem's with the family, speak to some of these panelists here who've got facilities and support systems that allow them to speak about these problems. So if you have someone on board that can push people into the right direction, then all of a sudden it opens that conversation up a bit more than just keeping it in. So having that person that is trained and has that sort of subtle way of sort of saying, have you thought about some form of support in X, Y, Z way? Maybe consider it. And also mentorship schemes is the next thing I would also advocate for as well. Even for new cadets like myself, when I was going on board vessel, I had absolutely no idea what to expect. I was fortunate I did do a voyage prior to my cadetship, but a lot of my colleagues afterwards, they didn't continue their time at sea, or even didn't finish the course because they were like, this is too much for me. 7 months at sea is ridiculous. I miss my mother's food, or I miss the creature comforts of home. But without having someone go and said, you know what, this is what a life at sea means. It means this. We would probably reduce the amount of people who struggle at sea.
Get the right person rather than...
Exactly.
So psychological profiling, understanding a person's internal issues, stresses, is such a personal thing. I mean, people spend billions of dollars, I think, especially in America, for having a therapist, anybody from 12 years old onwards. How can you do this on a mass scale? I mean, you surely can have personal relationships with each and every crew member on your ship or in your company. So how do you actually physically get to understand people? Because everyone, like you said, nobody likes a checklist, right? It's not a checklist. So how do you get to really assess mental health in, 5 minutes or less? Because the seafarer doesn't want to spend another 5 minutes with you. He just got off his ship, he wants to go home. So how are you going to get to the nub of the issue on a mass scale when it is such an individual, personalized process? Mariangela.
Yeah, well, first of all, you can't have change unless you have people championing this change at every level of the organization. So one thing is that you need everyone to get on board and really, understand why it's important to feel well, and that it's it's very normal not to feel well. And when you don't feel well, you can just talk to your teammate about it, and he can be aware of it. So it's about really creating a culture. Now, you've touched upon a subject that is very sensitive for me, which is about the profiling. Now, in recent years, all this talk about, from regulators, about psychometric assessment, this is a really unregulated market in the shipping industry. Outside of the shipping industry, psychometrics is really highly regulated. So it's just a sort of recommendation for companies to be aware that when choosing to do a sort of profiling, you need to know that the test is actually, like we heard before, valid and reliable and scientifically, working, robust, because there are many which are not, unfortunately. Now, so in reality, you need to prepare for what you're saying. You can't do it, reactively. You have to do it proactively. So you need to have a culture of openness and collaboration where you've normalized mental illness and mental health. And you know that, when I see you not feeling well, I can just, say, is everything okay? And then you also have the services of the people in this panel that you can refer to and get help and,
I was thinking, basically referring to Lieutenant Uhura or whatever her name was. There was this counselor person who was a psychological profile on Star Wars or Star Trek or something that is constantly on board the vessel, just there for mental health issues. And
Yeah.
going back to the 60s or 70s, Star Trek.
No, it wasn't Star Wars, it was Star Trek.
Yeah. Charles, so big data, collection mass data, individual response. Where are you on the spectrum? How do you actually get the real data and then be able to have systems to absorb it all? Profiling is an individual thing? Is it a whole ship?
Let me answer the first question, just so I don't forget about it. About resilience, you need 3 elements in place. You do the training for the seafarers, mainly the leadership positions, because they will drag it down. And then you need to train the office staff, because if that communication isn't aligned when it comes to mental health and the same type of training, it's going to get lost in translation. And the third part is you need, just like we have medical advice on board, if things happen, you need psychological advice from maritime psychologists or clinical psychologists that can then help if something happens on board. So they can say, okay, I got the training, but I know if I need the network for resilience, for support, I can reach out and I'll get a proper advice. So I'll keep that. That's the answer for that. When it comes to big data individual, I just want to demystify something. I want to explain something. Therapy is not something you should do on board. It's not ethical. It's not the right way to go. What you're doing is you're giving people stabilization, psychological support, and of course you're helping with certain processes, but you're not going to do an intense therapy in a dangerous environment while the person's working, especially not in an environment that you can't control at all remotely. It doesn't make any sense. What you want to do is you want to stabilize. So you don't need to get to know the person, all the nuts and bolts. What you need to do is you need to offer the initial support, which then when they disembark, they can carry on and get someone and do that nuts and bolts stuff. That's okay, right? When it comes to assessments, they're never going to be 100% accurate. Like what it was said earlier, you're getting a snapshot of something right now. This can change in a couple weeks or a couple months, of course. But if you have the onboard support and you got the training, people might recognize the red flags, reach out before the person stabs, hurts others or themselves, right? So that's what you need to do. It's you're not trying to do a profiling of a person. That takes weeks, months, if you do it correctly. Okay, and even if we give a diagnosis, any diagnosis, it's a preliminary
diagnosis. Being very superficial, then?
Huh?
Is there a danger of being too superficial?
No, it's not superficial. It's still in depth because it's practical and it's helping the seafarer, the person in question, with what's relevant right now. That's important. And then, once later, you can then carry on. But the most important thing is practical, immediate mental health help where it matters.
Ben, thoughts?
I think certainly we are increasingly being invited to pre-deployment seminars to help prepare seafarers for a life at sea, and I think that is absolutely
what Janis was saying.
Really important.
Make sure you get the rights.
But I think also, utilizing some of the existing import services, obviously the Mission to Seafarers, but all the other societies around the world, collectively, I think we cover over 900 ports across the globe. And the vast majority of import welfare operators are trained in critical incident stress counselling, in signposting, increasingly in suicide alertness, and we have a number of suicide alert workers. And that's not to say that we are licensed in that sort of, we're not psychologists, but what we are actually able to do is walk alongside seafarers and be part of that toolbox to then signpost them to more clinical or more professional support should that be what they need. And I think, this is all about ensuring that seafarers have their own ownership over their mental health and their well-being. I think there is always a danger that if it's too top down, seafarers will just respond in a way which they think you want to hear, rather than actually empowering them to make their own decisions for what they think they need.
Dr. Deepti, would you like to share your comments? Dr. Deepti, can you hear me? I think we've lost.
Yes. Okay.
Hi, Dr. Deepti, can you hear me?
Yeah.
Okay.
Yes, I can.
So
I can.
could you like to share your comments on the subject?
Yeah, I'll just, something which we started 2 years back here, and I agree with what Charles says, that we cannot do therapy on board, which is very true. So what we have started doing here, there are two parts of the training which we do. One is psychological first aid. So that we do it for all the officers and the top 4 level as well as the junior levels who go on to the ship. So before they join the ship, we put them through an intensive training of psychological first aid. The objective here is not to make them psychologists. The objective here is that they should be able to identify certain red flags, as Charles was saying, on board, so that they are able to report that and provide basic counseling for till the person is not safely repatriated back home and does not indulge in any self-harming. So that is one thing which we do, that is psychological first aid. The second thing is training given to people who are handling calls in office. So like I think one of the panelists mentioned that some of them are not even seafarers who are sitting in office and attending calls which are coming from board. So here we try and teach them about empathetic listening and trying to teach them how they should actually take calls, listen carefully, and try and understand what the seafarers are going through. So we first train them about what are seafarers, what kind of work they do, what kind of pressures they are into, and of course we share a lot of videos of on board and how the life out at sea is. So we do give them training on communication and empathetic listening, which is very important so that they are on the same page like the seafarers. So if somebody is calling up from the ship, they know, yes, this person is in distress and this person is going through, and they are able to relate with it. Relating with the person on board is very, very critical in the welfare of seafarers when we're talking about. And the third training which we do is for the cadets. That is, we do, I'm associated with Sailor Society's Wellness at Sea program, where it prepares the cadets like, he rightly said when he was a cadet, when he joined as a cadet, he didn't know anything much on how the life out at sea is. So the Wellness at Sea program we offer to cadets, wherein it's a 5-day program where they go through each and every aspect of wellness, and it prepares them mentally for life out at sea. So we don't just show them a rosy picture, because otherwise everybody feels, oh wow, you're in a uniform, you're going to be having an adventure on board, you're going to see the world. Well, it's not a bed of roses all the time. So that is a training which the cadets go through. And the last part of it, which we focus on, which is a very neglected crowd, I feel, are the ratings on board. The ones who are ABs and the OS, who are, they are longer on the vessel than the other ranks which are there on the ship. So we provide them with the basic mental awareness training so that they are able to understand that if they are going through some problem themselves, then they can speak to someone whom they can reach out to, whom they can talk to, and how they can approach the company and what kind of a help they can get. So these are the 4 levels of training, because I feel it's important. You don't have a doctor on board all the time. You don't have a counselor on board all the time. But this program has really picked up well, and it has benefited, especially in the COVID times. We got calls from ships that it has helped them to identify people, and they've become more empathetic towards them. So I think this is what I would like to add. The training is extremely essential.
Excellent. Okay, we're just about out of time. I just would like to close the session by asking each of you, if you had a 1-minute ride or 2-minute ride in an elevator with the CEO of a marine company, what would be your elevator pitch as to what is the most important thing that he should be doing with regard to mental well-being of his seafarers? I'll start with Charles. You only got 2 minutes, right? The elevator is going to reach and he's going to walk out.
Right, I need to make that pitch quickly. I would say, if you want to save lives, have more effective work crew, a more creative and happy work crew that really appreciates the company they work for while feeling safe, you need to invest in psychological safety and mental health.
Invest. Dennis.
Yeah, I'd say, only they have the ability to create that environment. So it's got to start from them. So, I'd implore them to sit down, create a plan, and allocate a proper budget towards crew welfare and mental health.
Marie-Angela.
Yeah, I would say that, the link between mental health and business, objectives and having reliability and consistency and business continuity has been proven scientifically throughout many studies. And I would ask them to bring some science into the way they manage their people and utilize, all this information we have from the part of science about building healthy workplaces where mental health is really championed. Yeah.
Ben.
I would say happy seafarers are generally safer seafarers, and then I would ask them, are your seafarers happy?
Very interesting. And the concluding comments go to you, Dr. Deepti. What would be your 1-minute pitch?
So I would just tell them that being a CEO, because you said he is a CEO, so I always believe that till the propeller keeps running, you will keep earning. And for the propellers to run, you need an efficient crew who are mentally well, because like it said, it's directly attached with safety. So if you have a safe crew, it'll be more productive for the company and for the business. So you need to invest in their psychological health.
Thank you. And thank you, all of you. Would you all please join me in thanking the panel
Thank
for an
you all.
excellent discussion? Thank you very much.
Thank you.
Really appreciate it.
Thank you so much.
Thank you very
so much.
And thank you all for coming. So concluding comments from the chair for the day. It's been a great day, and I'm ready for a drink. Thank you. Bye-bye, and thanks for joining us today.
Thank you,
Thank you.
Fazli boy. Did I pronounce it correctly?